It is Breast Cancer Awareness Month, so you've compiled some really fun facts about your breasts, stuff you might not know and maybe you haven't thought of before, starting with their size. Let's talk about their size. They don't match.
They don't match. We call them twin peaks, but they're not identical.
They're not twins. Yeah.
So they actually did a study, like a study where they took successive pictures of women's breasts and at Emory University in Atlanta. And they decided, or they figured, that one breast was larger. Do you know which one it is?
It's always the same one that's larger?
Yeah.
I would say the right. Is the right larger?
Wrong.
It's the left that's larger.
The left, see, they're all like,
Oh, they're like, yes, my left is larger.
Just as an anecdote, I've nursed a small nation, so, and I'm right-handed, so it was mostly on the right.
Yes.
So it's not my case, but whatever.
Oh, right, because where you nurse the most, that breast will often be
Which
bigger.
is another fun fact about breasts. Because they're not just ornamental.
Yeah.
Their ultimate destiny is to lactate. And we have different stages of breast development over our lifetime. The first time that they differentiate is at puberty. So when we start to ovulate and our brain speaks to our ovaries and we start making estrogen and progesterone, well, our breasts have receptors for estrogen and progesterone, and then they start to differentiate. They have phases. Phase 1 lobules, because they're kind of like branches with buds at the end. The buds is where all of the hormonal action will come when lactation or milk comes into play. Right. So you have phase 1 lobules, 2 and 3. They become phase 4 lobules only after you've lactated. So you can be completely mature, you have glandular tissue and stroma and fat in the breast and suspensory ligaments and all of those things, but the full purpose of your breast's development is for lactation. They exist to milk.
And then after they're done milking, then what?
Well, then those buds regress. That's a good question. Yeah, there's something called atrophy and regression of these buds, so you have fewer and fewer buds, and then the breasts, as we reach perimenopause and menopause, become more fatty, and because we have less estrogen around, there's less tissue turgor, so the suspensory ligaments get looser.
They drop.
And they drop.
They're tired.
They're tired.
Yeah.
So then we have to wear better brassieres.
That's right.
Yeah.
We always have bras. They always have your back. It's fine. Let's talk a little bit about their weight. So what would you compare the weight to?
So in medicine, we always talk about fruits, right?
Yes.
Because of what things. And people talk about breasts as melons often. They'll do like jokingly.
Yeah.
They're not the weight of melons.
They're not.
No, they're more like grapefruits.
Oh, okay.
So it's 1 to 1.5 pounds as opposed to melons, which would be 3 to 5 pounds.
Yes.
However, we talked about lactating. So if you're breastfeeding, they get heavier.
They're very heavy.
So they can become melons when you're lactating.
Absolutely. You say we're not supposed to sleep on our breasts.
Because we can modify the shape of our breasts by laying on them.
You flatten them?
Pancakes.
Pancakes. First of all, it's not a good position to sleep in for your back. I'm a front sleeper, a stomach sleeper. I find that so comfy, but something's happening to my girls when I do that.
You're changing the shape of them.
I'm flattening them out.
Yeah, you're playing Play-Doh. Yeah.
Man.
So if you really want them to be perky, perkier, I know perk doesn't sound right, but if you want to maintain the shape of them, you sleep on your back.
Right.
And you can sleep with a sports bra.
Sleep with a bra?
Yeah, because it holds them.
Never!
Yeah, I didn't say underwire.
Right.
I said sports bra.
That'll keep them in place, right?
Yeah, right. Yeah, it holds them up.
Let's talk a little bit more about sports bras.
Yeah.
Sports bras are a fairly new phenomenon.
New phenomenon. The 70s. Everything good happened in the 70s.
Yeah.
Just saying.
And are you saying, are they good support?
They are good support. They hold things in place, and they don't necessarily constrict. However, do you know where the first sports bra came from?
Where?
2 women in 1977 sewed together 2 jock straps.
And that's the sports bra. Yeah. Very good.
It was smart, right?
That's a very smart
I know, so
idea.
but thankfully spandex came so we can jog without being like...
Totally. Wow, that's a very good idea. All right, let's talk a little bit about breast cancer awareness, because you do actually have some good news.
Yeah. Detection rates are increasing. So we're better... I think because we talk so much about our breasts and openly, and now we're tongue-in-cheeking it, but really being aware of the fact that it's important to do self-examinations, to see your primary care physician, and to notice the changes. The best time to do the examinations are 3 to 5 days after your menstruation. And in the shower, you're the best person, you know your breasts. Look, if you find changes bring them up to your healthcare provider. Don't assume anything of your own. It may be something that's completely benign. We now have detection methods. We have mammograms. We have breast ultrasounds. These are all things that you can bring to your care provider, and it can be done as a preventative measure if you find something, and early detection is key.
How often should we be doing breast self-examinations?
Generally speaking, you want to be doing it at least twice to every 3 months, every 2 to 3 months.
Yeah.
Because we don't know when the changes are going to happen. We don't start mammograms till between 40 and 50, really. So we don't expect anything young, but if you have a history of breast cancer in your family, if there's a hereditary type of breast cancer that you are at risk of inheriting, talk to your primary care provider about it, and they will put the right tests and sequence for you for your specific case.
Very good, Marjorie. Really good breast facts there. I like it.